Hi, my name is Grace. I'm a fourth semester nursing student and I'm going to be demonstrating the skill of nasopharyngeal suctioning. Hi, Mrs. Jones. My name is Grace. I'm going to be your nursing student today. I'm going to be performing some suctioning on you, okay? Can you verify your name and date of birth for me? Thank you. I'm going to ensure that privacy is there. I'm going to raise the bed to waist height. And I'm going to want to make sure that there is an order in place for the suctioning, and I'm going to want to assess all the proper vital signs. That will be oxygen saturation, pulse rate, respiration, rhythm and depth, adventitious breath sounds, change in mental status, any gurgling, and then I will want to listen to my patient's breath sounds, 6 on the front and then 2 on each side. When I'm sure that the breath sounds indicate a need for suctioning, I'm going to go ahead and turn up the oxygen and don some clean gloves and ensure that my suctioning is working. And I will test that by placing my thumb over the end of the tube, and to make sure that this was not hanging on the floor when I came in and that this has not been there for more than 24 hours. Once I'm sure that my suctioning is working, I will remove my gloves and perform hand hygiene. Next, I will prepare my patient for the procedure by raising them to semi-Fowlers if they are conscious and have an active gag reflex. If they do not, then I would have them laterally facing me. I'll put a towel under the chin. And I would want to ensure that my suctioning was 80 to 120 as well. Next, I will make sure that my sterile water is not more than 24 hours old, and that my gloves and suctioning kit have not been opened, are the correct type, and are not expired. So after I performed hand hygiene, I am going to go ahead and take my container out for my sterile solution and lip my sterile water. At this point, I may also don a gown and face mask if required. Next, I will open my suctioning kit, making sure to respect my 1-inch margins of sterility. And then I will don my sterile gloves, also making sure to respect my 1-inch margins. And ensuring that my thumb does not touch when gloving my non-dominant hand. Next, I will remove my tubing, keeping it coiled in my hand, and I will measure from the nose to the ear, and then from the ear to the base of the neck, and that looks like it's about 25 centimeters. Next thing I will do is I will attach my tubing, and at this point I will be breaking sterility on my non-dominant hand. I will lubricate and check the suctioning by pressing my thumb intermittently over the hole. And then right before I begin to suction, I will remove my patient's oxygen and I will tell them to take deep breaths and cough as needed. And if I meet any resistance in the nares, I will stop. Going 25 centimeters and then rotating and applying suction as I remove the tube, and then rinsing the sputum out of the tube and giving the patient 30 seconds in between suctioning to bring back up their oxygen saturation. And then once they've had 30 seconds, I will remove their oxygen again. And I can do this 2 to 3 times, but for not more than 5 minutes total, with 30 seconds of rest in between each one. And then once I am finished, I will rinse my tubing, detach, clean this up, ensure it's not dragging on the ground, and put my patient's oxygen back in. Coil this in my hand, dispose of my gloves. At this point, I will document the patient's tolerance and their breath rates before and after the procedure. I will document the amount, color, appearance, and odors of any sputum collected in here. And optionally, I can also date and time this so that I can ensure that's been changed the next time I come into the room. I will lower my patient's bed, ensure the call light is within reach. And then lastly, I will ensure that there is a new suctioning kit in the room for the next person to use.